She said 9 to last patient, but her car got fixed over the weekend, so it shouldn't be an issue anymore.
I mean, we're just part of the club.
Hey, Jerome. Good morning. Good morning.
No one's on yet.
Oh, perfect. I'll just say good morning to you.
I literally.
So what'd you end up doing this weekend?
Saturday I went and I got a new bath mat for the bathroom, and
At Home Goods?
yeah. No, actually Target. Everything was like
Target.
yeah, and I got 2 towel sets Are you kidding me?
Why?
How? This is regulated goods or themes.
Is it because you said Target?
No. Submit. This is ridiculous. Literally ridiculous. Let's see.
The TikTok police?
Oh my gosh. Well, I mean, like, if these insurance companies could just use the money they're spending to, like, keep us quiet, instead, just use that money to pay for people getting treatment, we wouldn't have as much to talk about.
I went and looked at all my pictures of him from
Did you know
September 7th on. What?
You can, like, put someone's face to where it's, like not always coming up.
No, I don't want to do that. I'm not there yet. We're not there yet. Okay, so my friend decided to clean my fish tank for me.
Ooh.
Okay.
He is.
Look, he ended up having to take his shirt off because he was, like, inside the fish tank. I know. He's like, that is not a flattering picture of me. I'm like, you're 65 years old. Okay, but look at his arms. His
arms are huge.
His arms are good. He's got a bit of a gut right there.
It's fine.
Although
it's the beer.
It's not even the beer. It's whatever.
All right.
And he took a picture of me saying, your hair looks like shit.
It's
I'm
his
like,
fault.
it's because it was in a clip. And we were in the hot tub time machine.
Yeah.
We took him and Michael out to Drake's. Do you ever go to Drake's?
I've
I guess
never
we
been
should have
there.
called you. Of course, I got my head stuck. And we went out to dinner with, this is his friend who's a Crentist and his second wife.
Oh.
This was such a great restaurant in Webster. Hadn't been there before. It was frickin'
Ooh.
We were in the dressing room.
Ah.
I bought him some new pants. I know. I actually didn't buy him pants. He bought pants. Oh, and this was Friday
boobs
night.
Look great.
This was Friday night.
Your boobs
now
look
what?
really good
Look how
there.
old my
I want
friends
to
are.
see your boobs.
My boobs do look good.
I just saw a nude.
Oh man,
These
nice.
are people that I've known longer than Steve Bach.
Aww.
I know. Look how old all of the men look. Well, that's not great, but whatever.
All right, guys. So this weekend.
And then my brother-in-law got this elk.
Wow.
That's giant.
Could Jerry
show
have a
that?
piece of that? I don't know. Regulated goods.
Yeah,
Thank
he was
you.
in Montana. My brother-in-law.
I've never been to Montana.
Look at this elk my brother-in-law shot.
Oh my gosh!
Guys, guess what?
Holy
What?
shit!
Hi, Denise.
What are we guess wedding about?
Oh, I was going to say that in health insurance was first created around the Great Depression. I think my grandma was alive.
It was not first created around the Great Depression.
I watched a YouTube video, so I'm pretty sure I'm right.
So you went to the University
I
of
went to
YouTube?
the
It
University
was in the
of...
60s that was
No,
created.
that's HSA plans.
Okay. Well,
ADHD.
all right.
You want to
so-
know what United Health, or who sponsors United Health Group? Salesforce. I don't even really know what that is. But, oh, you have a phone call. University.
Sarah Bach.
This weekend I started painting.
Good morning. Oh, sorry, we're on live. What's going on? No,
She's walking away.
I guess I can.
I guess. It's okay. I'll get the people ready.
Okay. All right. Well, all right. I'll be right back. All right, just paste it in here.
Woo!
You might be able to.
All right. We're here. Hi, Jesse. Yep. Oh, we. Is this still restricted? It's so crazy. It doesn't even make sense why we are restricted, but are you a nurse? I fight for the nurses, you know? So, I watched a few YouTube videos and thanks, Dave. I started reading a book about economics because I don't understand economics. And it talks about how, in order for. How are you this morning? One of these 15 people, I'm pretty sure, reported this. Hi, Jesse. Hi there, how are you doing? I'm good, how are you? Your favorite? That's amazing. I want to have Carmelita braid my hair. I wonder if she'll do it. Or at least, like, no problemo. Where are you from? America. Thanks, Dan. Drum. Come on. Look at him. Oh. Say, show the people. Show the people. Good morning. Hope you're having a good morning. I'm at the gym. Really? Nice. Hello, Australia. Bonjour. Look at Jerome. Look at his little bow tie. Hold on. Show the people. Yeah. As always. Missouri. Isn't he cute? Thank you, Mark. The pharmacist therapist. Jerome, unlike his mother, he's pretty camera shy. But he's soft. Why are you hiding your face? He is shy. Thank you. Oops, sorry, Jerome. There he is. There he is. Say hi, Claudine. Have fun. Chat later. Yes. Salesforce. I don't know what Salesforce is. Wait, is that Greenway? Hi. I'm good. How are you? Thank you. I hope it makes you smile. Thank you. Handsome boy. Handsome boy. Oh. I wonder, maybe it's just Julie that gets reported. Thank you, Papushka. Very lucky dog. Carmelo. I have tooth boost on my lips. Sup, G? D-O-double-G? Snoop Dogg? There it is. No, that was quick. What? It's short. Why are you tripping for the spot in the sun? Closer to the sun and he won't sleep. Good morning, gorgeous. What a cute doggy sitting in the back. Thank you. His name's Jerome. I had mascara on my eye. You must have the best shit talk. Yeah, kinda. It hurts, that's for sure. He's just sleepy. He has a new bow tie. It's just funny because what I say is funny. Oh, it's a puppy dog. That's my baby dog. Hi, beautiful. Bonjour. Je m'appelle Claudia. Let's see if my appeal's still in progress. That's so crazy. No, it's it. Today I'm working, so I can't paint. Fox Live. Come to St. Louis. Bonjour. No parler français. Merci. Oh, oui. Money. C Money 636 is what they call me in the street. Good morning. Olivia. Merci. Bonne soirée. Je m'appelle Claudia, no parler français. No. Hey, that's Jerome, my dog. All right, Carmelo, like, what's going on? But I can't sit, but I'm getting reported for regulated goods, but these people can just freaking say whatever. Hi, Wyatt. I did. Poor one. He's fine. He prefers it. Thank you, Carmelo. What is that?
I see you peeking. Just some Christmas ornaments in a damn CBD bag.
We are the champions. My friends. Will you do 2 braids in my hair?
Matching. Did you wear yours today?
Wear my what?
Your sweater jacket thing.
Mm-mm.
It's like brown and white.
I don't think I have one.
Yeah.
Could you?
It's a hoodie or something.
Will you do 2 braids?
And
Yeah, I'm allowed to take Jerome to work.
oh my God, you're on live.
Hey,
I
no.
didn't even see that. I was wondering what you was staring at.
I needed. You could do 2 braids.
Another one.
I burned myself. Feel it. You can feel. Braids fit you for real. Thank you. Why is watching you fight for people the way you do so incredibly attractive? We have AA Ron. Thank you. Is that Carmelita? It is.
Hi.
She's Rapunzel.
Can't see my hair. Why did that?
I know.
Why she cut? Why
I
did
know.
She cut all the way up?
I know.
Oh, I don't like her.
She got fired.
Who got fired? Oh.
They
Your
ca-
hair's so cute. Why you want to mess it up?
I want, because I think it'd be cuter like that. There's a good atmosphere at work. You are lucky.
It's great.
It's so good. Like, we all get along really great. Carmelita asked Claudia about her maths debating. Gosh dang it!
What do they know that I don't know?
So, I didn't understand it, and they were talking about what I thought was debating math.
How'd your head back?
And they're like, tell us about Claudia, why are you? And I kept saying it, and they're like, say it slower. And I'm like, maths debating.
Oh my God.
I didn't get it forever. Don't you? No, I don't really. Boyfriends are headaches.
Yes, they are. Husbands too.
Husbands are. I don't even know. I can't even get one.
Brain aneurysms.
Don't.
I shouldn't say.
Lucky or cute? Why am I lucky I'm cute? I've got a brain
You
too.
didn't get the job.
Oh, my dad used to. I am lucky I'm cute. My dad used to say that to me. He said, "You're so pretty." I'd be like, "Why are we talking about how pretty I am?"
I think I said that before. I ain't gonna lie. Oh, she lucky she cute.
But I'm so smart sometimes, you know? Her hair would look really good bleached.
Mm-hmm.
I think they're talking about yours.
Oh, mine?
Mine's already bleached.
More bleach.
Yeah. I think I'm gonna go brown.
I want my hair bleached.
I work on healthcare, and I do
What are you gonna do with this part?
medical benefits. Just, don't we have the little ponies at your desk?
Oh,
To be honest, you're so entitled. Yeah, I am. Would you like
I
to?
have a story for you and Julie.
I'm on
You
live.
will not be shocked by this at all. So my the guy who picked me up at the airport last night, take me over to the parking lot where I left my car. We were talking, and I was the only person on the van, and he was talking about his wife. He married his high school girlfriend. He went in the military, went to Germany, came back, and they basically lived their whole life together.
just for now before.
She died last year.
Aw.
She had just been diagnosed with, she was a new diabetic, and her doctor decided to put her on Jardiance. So they gave her 2 weeks of samples to take home. Well, then her insurance company wouldn't approve it. So she did the 2 weeks of samples, came off the Jardiance, and died within 10 days from diabetic ketoacidosis.
Gosh.
Yeah.
Did you get his information?
His name is Harley. He works at Easy Park, Easy.
I'll call him.
I can get you in touch with him. Yeah. This is, I mean, seriously.
Yeah, it's a problem.
Died.
People know it, and
Okay,
that's
this
what
wasn't
happened.
like a woman who was a chronic diabetic for years and years and years. She,
Well, that's what happened to one of our friend's sons. He had been an asthmatic his whole life, and he went to pick up
Right.
his medication, and it was
Right.
$500.
Right.
So
I couldn't
someone
afford it.
my age, I couldn't get my medication if it was
I
$500.
can't do that right now either. I
Went
couldn't do
without it
Couldn't do
and
it.
died.
Yeah, seriously.
They're playing
know.
with people's lives, and
And they don't care.
Mm-mm.
And they ultimately have no legal responsibility.
Not at all.
They walk away
Exactly. No, and doctors, like a lot of like, even one of our friends, she was like, because Salesforce said that they back up United Health Group, and she was like, I'm tired of fighting a losing battle. And it's like, that's what they want us to do. Like,
Correct.
it's been a fight forever, and a lot of physicians are losing the spark, but it's just like, they have to remember, like, you
I
guys
know.
are the ones that have the clinical education.
Wow. Yeah.
They're going to try to like do whatever they can to dictate people's health, and
Yep.
this is when doctors need to stand up and be like, this is bullshit.
It is. It is. But we can stand up all we want to because unfortunately the insurance companies have hired so many physicians, and so our peer-to-peers and our approach through the insurance company, we're now dealing with guys like us who went to medical school, guys and gals who went to medical school just like us, and
Could you
they got out
imagine
and
selling your soul and like having to be
No,
someone
but
that
I know a
causes
lot of
harm?
these people, and they have a great job. They have a great job.
Yeah.
They work 6.5 hours a day. They have, they work 5 days a week, and they have paid vacations, and they have benefits, and they have things that guys like me have never
Right.
had. I've never had benefits.
Right.
I've never had benefits. No, no one has ever paid for my health care insurance other than me.
Right?
Yeah, yeah, and it's expensive when you write a $3,200 check every month for health insurance.
Right.
It's expensive. Private health insurance is
And
not
then
cheap.
chances of it even being covered, like Julie had to pay cash
Scott-
for one of her
at
MRIs.
that point, every individual in the family still has a $7,500 deductible.
Right.
There's an aggregate deductible of $45,000 or $50,000, and every individual has $7,500.
I've literally said, like, if I get hit by
Yeah.
a bus, just leave
So
me
you're
there.
paying. So
I'd
you're-
rather die.
You're paying $40,000 a year in premiums for nothing.
Right.
For nothing.
Just
Just for
to
having
say
a
you
card
had
in your
it.
pocket that you're covered in case something catastrophic happens.
It's gross. And then if something does happen, you can't even use it.
No, it's no good. No. It's just nothing fun. So anyway, Jerry, I didn't even see you hiding out back there, buddy.
Jerome.
Man, you were pretty effectively hidden away there.
He said I got a new bow tie
Yeah.
for
Oh.
Thanksgiving. Cute boy. Say hi.
Yeah. He's like, I know him. He gives me treats.
But no, I'm even talking to people and they're releasing a documentary, and
Mm-hmm.
the one guy said, he's like, I'm genuinely scared for my safety. And he's like, because if this comes out,
So
I'm messing with like billions of dollars, like BlackRock, like
so the last year and a half. Let's say that's what I'm doing. Last year and a half, I haven't had any health insurance.
I
For the
didn't-
first time in my life. For the first time in my life. But I'm 62 years old.
yeah.
I can't afford to go without health insurance. Seriously. For the
But
first
like,
time in my
what's the
life.
point of health insurance at the same time? You
Well,
know?
and I somewhat realize that, but it's a safety net. It's a safety net. At least gets you in and out of an ER.
Well, they can't not take you in an ER.
I know.
So
But then they're gonna track you down and they're gonna chase you, and if you
you'll file you'll file bankruptcy with medical debt. I mean, it happens
that's
to
the number that's the number one reason for people filing bankruptcy.
1/6 of Americans file bankruptcy because of medical debt.
I'm off the
So-
call, Pippi Longstocking.
Just told Claudia. So last night, what I wanted to tell you is my the guy that picked me up at midnight at the airport and drove me to the parking lot. I was the only person on the van, and he was talking about his wife that just
Thanksgiving
died
is
last year.
on Thursday.
So he was married to his high school sweetheart. They started out in Peoria, Illinois, lived here for decades, and she was diagnosed with diabetes a couple years ago, and her physician gave her a 2-week supply of Jardiance. The insurance company wouldn't approve it. She took her 2 weeks of samples, and when she went off of it, she went into a diabetic ketoacidotic coma and died.
Wow,
Yeah, and she died because her insurance wouldn't approve it. Yeah,
that's classic.
I know. Yeah.
Healthcare's in the toilet. We
Yeah.
gotta get it
Could-
out
I
of the
mean,
toilet.
Just slap in the face.
Like,
There's-
why have
we-
insurance?
This is why you do what you do every day, because we all deal with the shit from the insurance companies, and them not wanting to.
Hear
do what
that,
they should do.
TikTok?
That's
Yeah.
Yeah,
So,
it is
anyways.
garbage.
It's disgusting.
How old was she?
Well, he's in his 60s, and I think she was a little bit younger. So, but, I mean, she was 60 years old, probably.
Ridiculous.
Yeah.
Well,
Yeah.
insurance comes in the way of a lot. Like even like mental health. If you go into rehab, a lot of these people stress out because they don't know if insurance is going to pay for their next day.
Well, they're not.
How do you focus on, getting better?
Nice. Fix it.
No, can I use that?
She still looks crazy. She looks like Pippi
But I
It's
Longstocking.
do-
not that straight.
But I do love all the commercials on
You
TV
messed it up.
because
Oh, yeah.
we laugh about it. It was like, oh, another
What do you
another
expect
fat
black
people
people
singing and
to do?
dancing commercial.
Yeah, you just have to have the right
Because everyone
insurance.
just wants to be on a semaglutide.
Right.
Insurance
care
and
what
health.
you're supposed to
My
do.
son got pneumonia when he was 7, and I took him to 5 doctors and 2 urgent cares. Insurance and healthcare have become a business. It's not about healthy outcomes.
It's about siphoning health, direct patient care dollars away from the physician, the pharmacist, and the patients, and into middlemen.
Well-
United Health Cartel,
And
Aetna.
with them being
Blues,
so
Anthem.
large, people are losing hope. Like even Nilsa, she's like, why are we fighting this losing battle?
Right.
And it's like, well, we have to, because if we don't,
We have to, because every one of us is a patient, and every one of us has been denied and delayed by an insurance company. That's just fact. You got to start over with her hairdo. It looks pretty bad. It looks bad. No, leave it alone now. Just it's fine. It's better. I don't know. It's worse.
We don't know.
I actually thought I was all cute this morning, and I came in and I had one of my clips in my hair.
I mean, drug companies aren't overcharging. It's the insurance. Drug companies are just as sick of it. It's not big pharma right now. Right
No.
now, it's insurance companies.
and pharmacy benefit managers. Listen, at least Big Pharma's producing a product.
Right.
Think about this: United Healthcare, Anthem, Aetna. Who else is there?
Humana.
Cigna. None of them produce any product. They don't do any of the actual work, but they do all of the denials. They're middlemen doing nothing except siphoning direct patient care dollars away from patients and physicians and pharmacists.
The company I work for is reversing insulin resistance, reducing diabetic meds, and insurance is now denying. And we have really bad water here in my town, and it's toxic. And my dad had lung cancer along with COP. You look amazing today, Julie. And we were told to
Thanks.
clean his port with the water, and it made him pass sooner.
Oh.
We sued the water department. That sounds like Aaron
Aaron
Brockovich.
loving an Aaron Brockovich situation.
Blue Cross Blue Shield. Let's see if our appeal got overturned.
Yeah, we
Oh, it's still appeal in progress.
what does that mean?
It's pending. Pharmacy Podcast Network, love you and love your work. We'll see you on Wednesday.
Yeah, we will.
Her name was Samantha, and she was my Aaron Brockovich 100%. Is it common that every time you're late on an insurance payment, it counts towards your grace period?
I don't know. I think that most people have employer sponsored health insurance, which is just automatically deducted from my business checking account.
Well, and then we saw someone even like her like plan is gonna make it to where generic are preferred, right? And then $400 is what they'll have to pay for medication.
For a generic. Yeah, that was United Health Cartel.
Like,
Yeah.
it's frustrating literally getting patients off of insulin while reducing A1C and denied. I mean, they're basically practicing medicine without a license, and physicians are starting to lose sight of what they're doing because they can't even prescribe a medication that they know is going to work without
Without the
Step
insurance
therapy.
saying, oh, you know what? We make more money on this. And they bill it like, oh, a very independent group of clinicians and pharmacists and doctors is choosing these drugs on clinical efficacy. No, not true. And we're doing it every quarter, so we're going to screw you all. No, the insurance companies are, and the pharmacy benefit managers, OptumRx, CVS Caremark, and Express Scripts are choosing drugs based on what they make on the back end rebate. They're getting rebates. They're getting pay to play. They're being paid from pharma. They're being paid from all sides, always.
right. Well, like exactly. Pharma's not totally to blame, but
At least they're doing something.
Right.
They're producing a product.
but the insurance has gaslit big pharma into people thinking it's all them. Like they're charging this much. This is why we have to do it. But it's any other trust. It would be an antitrust.
Hey, what's up? I'm good. Can I call you in
Please
a few?
hold.
I'm at the office, of course. It's Monday. All right, namaste. That was my friend Chuck Thal. He should be watching us live. He should know what I'm doing.
Right.
He's not. He's asked me if I'm at the office. I'm like, yeah.
So you're not watching our live.
Right, right, exactly. Well, he probably got he
See,
got
Money, it
canceled.
looks to me you work for a pharma company.
She doesn't. She's paid for by Arthritis Center funds, by me. I pay her. She does what I tell her to do most of the time.
Who do you work for?
Me? I work for myself.
And I mean, you can look at all my TikToks. These
We're not,
manufacturers are so scared we're going to go live about their product. We call out the truth. I'm just being honest. We get denied for bowel preps all the time. Like, okay, you agreed to authorize the Colo. Hello from Russia, but
Russia.
not the meds to do it. Hey, that happened to me the other day. My quantity was approved, but the
not
medication
medicine.
wasn't.
Right. You know what? It's just such a jacked up situation. Literally, the healthcare system in the United States of America is the biggest scam in the history of the
Our
United
appeal
States.
was not approved. That's insane.
And,
And
all-
this is a prime example of them
the health
wasting their
cartel.
money because they don't want to hear what we're saying. They don't want other people to hear what we're saying. So what are they doing? Restricting our lives so it can't go onto the FYP page and other people can't see it.
What's
'cause
FYP?
for you?
Oh.
It's the suggestion.
Okay. So,
Like, why would they want to shut me up? I'm
they wanna shut
5'3".
you- Yeah. You're
And-
112 pounds soaking wet, and somehow big insurance is worried about what we're doing in freaking Bridgeton. Okay?
Like, how pitiful. I just wish they would have to, like, come talk to us. Like, hey, I'm the one that reported your TikTok.
They'll never do that. We need to just pivot to different social media sites if TikTok is so overwhelmed with these crazies.
Let's just say they went to work right away. Let's say they did. Well, no, we're not selling supplements because
We're not selling anything. We're
Dr.
selling
Bach
hope.
always said supplements aren't regulated by the FDA. And Rowdy, keep spreading the truth, girls. We made it to your FYP. That's amazing, Towns. Well, I guess we have 108 people, so how do you get 108 people not to share it? And if everyone keeps tapping, then we'll show up.
Yeah.
That's one thing that we have is everyone on here knows that we're being honest.
Yeah.
We've shown you every side of our life. Why would we lie about what's going on? We wouldn't.
We wouldn't.
Now with these insurance companies, they'll lie on freaking in the middle of a court case.
Well, yeah.
Under oath.
They lied to the Congress about do you spread pricing? Oh no,
No.
not us.
No.
Yes, you.
Like,
Do you mandate to your own pharmacy?
No.
No,
No.
not us.
Like-
yes, you do. I mean, it's time for finger volleyball.
oh man, it's so insane. It's so insane. Do you reckon?
I just won.
Do you? No. So it's literally
I just
this
won.
is insurance companies versus physicians.
Right.
I'm hitting.
I won.
I'm using my nails.
Oh, you broke it.
PBMs killed independent pharmacies. Not if everyone calls HR 9096. Pharmacists fight back.
She broke this.
This is why we can't have nice things.
This is absolutely.
I'm so
why we
glad
can't
that I
have
never
nice
tried
things.
to play
Oh my God!
with
Look at
Dr.
that!
Bach.
You wrecked it. You totally wrecked it.
But
If you would have broke this on his watch, he would
he
have
would
been
have
so
been so
upset.
mad at me. Hello, mother-in-law. How are you?
Mother-in-law, is that me?
I guess so.
Oh, okay. Oh, is that Michael? Hi, Michael. No, it's not.
I was like,
Michael and Emma should be at work. Okay, so
you have no faith that bill will pass. We only need one more co-sponsor.
yes, you need to have faith that bill's going to pass because you're going to have a lot of angry people.
Well, and all these independent pharmacies, without them, what are we gonna do?
I got Aetna reached out to me to say, hey, we're here to assist. Please contact us, our social media customer service at Aetna.com. We need your provider name, Twitter handle, provider phone number, contact, tax ID, full description of what your concern is. And I wrote back, nope, you're not here to assist. Call me if you want to help. Not emailing you because you don't answer. Then they're like, we ask that you securely send communications. I'm like, well, forget it. We'll keep calling your gamesmanship out on social media since you value profits over patient care. We're right there. Yeah, they don't care.
But
They
they are mad because you have them in real time doing what they do. That's very true. that's what's different about us, is we can show you real time because our patients want to stand shoulder to shoulder and they're just as fed up as we are.
Well, and in rheumatology, absolutely every single thing we do gets prior auth delayed and denied because we have a giant target on our backs because of the price of the medicines we prescribe. You would think that a physician's prescription would be his or her prior authorization. No, not in the United States of America. That still needs to go through the cartel, either United Healthcare, Aetna, Cigna, Anthem, Blues, Evolence, whatever the hell they're calling themselves now. So,
Well,
garbage.
and hi, Angry Dad.
Hey there. Top of the morning. It's Thanksgiving week. We're working Monday, Tuesday, Wednesday. Are we working a half day on Wednesday or a full day?
We have a podcast Wednesday.
Okay. Well, I'm in it to win it. I'm making stuffing for my family. Stuffing for 44 people. Doesn't that sound fun?
But I actually have faith that we can make a difference because if we had 4 co-sponsors in one day, somebody's listening to us.
Well, what's going to happen probably is we're going to get another co-sponsor, but they're going to try to clip out parts of the bill. That's what they always do.
Really?
Yeah, but we're going to try. We still have a paddle in our hand and we row for the shore. You can't not try.
Well, if we give up, then I need everyone to watch It's a Wonderful Life because that's kind of what's going on with health insurance. It's the big guys trying to kick out all the little men that help take care of people, like George Bailey. You both are beautiful ladies, natural beauty.
Me, not so much.
Do you
I have
guys
a lot of
think
makeup
third-party prior auth reviewers are worse than internal reviewers? I think they're both pretty bad.
Well, they're all based on algorithms. So it's really, an algorithm will see you now, an algorithm will deny you now. The insurance companies are literally set up to deny and delay care. That's where they make the long dollar. The less amount of money they pay, the more they keep. So the higher the prices are, the more the percentage they have. So there would be no incentive for them to bring prices down. They only make money if the prices stay high and patients are on expensive drugs.
Well, that's what I was learning. I'm reading my economics book, and everything's supposed to go off one another. Like, obviously, gas companies are greedy and they want to raise the price, but it's the economy that allows them to raise the price. So really, we're allowing the insurance companies to think they have the ability to raise the price. And then, because we need the stuff, so there's no demand because people can't pay for it.
And that's Econ 001.
That's
Not even
Econ
101.
.0001. Can you re-explain what this bill is?
Yeah, so this is, it's HR
9096.
HR House
Representative.
Is that what it is? HR House Rule? Whatever, I don't know. HR 9096. And it's a pharmacist fight back. And the pharmacists have gotten together and with an army of patients because the pharmacists, the physicians, and the patients, and actually the employers, we all 4 want the same thing, which is the right medicine for the right patient.
At an affordable price.
Right. But who doesn't want that are the insurance companies and the pharmacy benefit managers.
These Fortune 500 billion dollar companies.
Right, and I would go on a limb and say Fortune 10 companies, not even 500, because Cigna, Express Scripts, OptumRx, and CVS Caremark are in the top 10, which is insane that they make so much money off the backs of the taxpayers, which is all of us. So the Pharmacist Fight Back bill is going to put some rules in that the independent pharmacists do not have to. They have to be paid a fair price. If they pay $10 for a medicine, they can charge $12 so that they make $2. Right now, how it is, if the medicine costs $10, how the pharmacy benefit managers work it is that they're only paid $8. So these pharmacists are having to cover a loss. Like, it's so crazy.
That's why they have the coolest retail stuff in there and these candle shops.
Thanks,
and
hot dog.
It's also going to make it to where you're not required to go to a specialty pharmacy like Express Scripts.
You're not mandated to a specialty pharmacy or any pharmacy. So patients can choose their pharmacy, and the independent pharmacists won't have to absorb losses because trust and believe, Optum, CVS Caremark, and Express Scripts, they don't ever have losses. That's all gravy all the time.
Yep, been saying that for years. They have no reason to approve things. It's not profitable.
No.
The stuff I see them not allow should be illegal. Greed allows the greed allows to raise the price. The insurance company feels like High School Mean Girls. It's so political. They scare you into thinking meds will be unavailable, but the rest of the world doesn't do it like that. They use scare tactics. Well, they do the same thing with these, like, copay accumulators. They're like, you're going to be responsible for 30% of the co-insurance if you run out. And it's like, these manufacturers have done the math to make sure that they're providing you with enough assistance to last the year.
But these are levers. These are programs that only benefit one entity, and that's the insurance companies. And somehow that's written into everything. So
I'm in medical billing, and I'm glad you two are doing this and exposing this. Somebody's gotta. And
Yeah.
I mean, what are they gonna do? You guys would miss me if you didn't see me. Insurance companies are the bane of my existence.
they're the bane of everyone's existence. The only people that benefit from insurance companies are the people that work there. And I understand everybody needs to, have a job, but good Lord, if I denied care for a living, I don't think I could do this.
Dr. Wingate was just saying, I mean, these people work 6 hours a day, Monday through Friday. They get paid vacations. They get good health insurance, all of the things that most people can't get. They don't have to worry about it. It's just like Wendell telling us he was on an airplane with gold plates and silverware.
Right.
Like, they're so out of touch with reality. And it's like, I work for one and I work 10 hours a day. Which one do you work for? I could never work for an insurance company after working in healthcare. Right.
Yeah.
No, even all the ones who work there, it's really the C-suite of maybe 6 people.
Right, 100%. 6 people at each company are like making the long.
Highmark, they treat me so bad.
Highmark, that's
Blue
Blues.
Cross.
Yep. They treat the patients bad. They treat the employees bad.
It's
nothing good.
well,
nothing good.
and it's amazing that they're in healthcare, but they don't even provide their employees with good healthcare.
yeah.
I'm saying that about CVS too.
Yeah. Well, you know what? We've got an opportunity to change some patients' lives today, and we're going to just carry on and go kicking and screaming, calling these people out and doing it one patient at a time because that's the only thing I know.
It's a nonprofit, Blue, still somehow, and I always say I don't work for the insurance company. I'm there for the members, a member advocate.
I would never want to be a member of a club like that. It's not like it's a gym membership that you have a choice and they actually recognize that you're a consumer. They don't give a rat's behind that patients are consumers. They're like, you're stuck with us for a year. So boo-hoo. Boo-hoo. Hopefully you aren't going to get hit by a bus because unless you get hit by a bus, we're not paying.
I even said if I get hit by a bus, just leave me there because I don't want to pay my deductible. Are all Medicare Advantage plans bad?
Yes.
Yes.
All of them are bad. Unless you have some serious cash and you don't care about therapy plans.
It's hard to find another job right now, but I'm doing it. I think our military service members should have the best health care there is.
100%.
And that's why they need to call about HR 9096 because a lot of TRICARE, they're mandated to Express Scripts.
No, not a lot of. All of them.
Like,
Yeah. Yeah, TRICARE somehow, the decision maker.
they
got
took
like a
away their
toaster.
freedom.
Yeah, and they mandated to themselves. Just unbelievable. Yeah.
My dentist told me insurance market started after the Great Depression. Yes! Thank you so much for throwing that in because I just told her that fact this
And I was
morning.
like,
Same, I'm only here because I have RA and they cover my meds in full. I mean, that's impressive.
Yeah, well, listen,
Did we get New Jersey yet? I'm not sure. Join the wait list for the documentary called The Modern Medical Mafia. Follow at Angry Dad WI to learn.
angrydad.wi?
But go to patientprotector.us.
Yeah, all of it's good stuff. These people are really doing God's work. All right, what's on the agenda for the week?
Well, it's Wednesday. We have a podcast. I think we should start doing, we have a Don't Back Down on YouTube, but I also think we should do like the history of health insurance.
Sure,
And how we
now
got,
that you read something about it, now you're going to have something interesting to say. Great, and you can start talking about 1936.
The Great Depression.
as you were born in what were you born?
96.
1996. She's going to talk to us about what happened in the 1900s. Not interested.
No, but it would be kind of cool to
Boring.
see how, like, to explain to people because they're always like, how did it get so bad? Because
Well, let's just talk about this. I'm 60 years old. I have 2 children. My children were born in 1995 and 1996. back then, okay, so you're talking about 28 and 29 years ago when I had my children. I had zero out of pocket to have a child, all right? I had a C-section with the first one and a VBAC with the second one, all right? Zero out of pocket, because that was only 30 years ago that you didn't have to have co-insurance, co-pays, or any of that crap.
You're a
That's not
professional
that-
beneficiary.
That's not that long ago. But since then, I mean, now one of our staff members has a baby on our insurance.
$10,000.
$10,000.
That baby already owes $10,000.
Yeah. And on top of that, the premiums have like 15 to 17% a year increased. Like, what changed in the last 30 years? Pharmacy benefit managers and health insurance. That's what changed. So we don't need to go back to the turn of the century in the 1900s. We only need to go back to 30 years ago when you weren't even born.
Well, I mean, insurance had to have been decent because I got braces.
Yeah. She was raised by
and I was
wolves.
raised by a wolf. So, like, things have changed tremendously. And I had surgery on my head in 3rd grade. So
Yeah,
it's
we're
like,
not really sure
We don't
about
know
that.
what it's about, but
Right. It could've
Affordable
just-
Care Act. Could you explain that a little bit? Because people say that ruined healthcare.
Well, it ruined healthcare a little bit because they penalized the people who didn't have healthcare. And
Oh, I got penalized.
Of course you did. Of course you did. But the Affordable Care Act has a couple of good things in it. One of them being that pre-existing conditions, you can't use that as an excuse to deny. So that was a good thing. And that the insurance companies have to show up and do something when you have the contractual relationship between a patient and an insurance company. That is like meaningful. But prior to the Affordable Care Act, they didn't care. They're like, if you are too sick, we don't want you.
But
Now they
Medicare
can't-
Advantage kind of does that now, right?
Well, no, Medicare Disadvantage, let's use correct terminology here. Medicare Disadvantage is a for-profit siphoning of direct patient care dollars away from the doctors and the patients doing the work and the pharmacists doing the work to the third-party middleman, okay? So you've got 400 different Medicare Disadvantage plans in Missouri alone, okay? If you have 400, that means there's 399 people, entities plus one, that are trying to siphon profits away. Traditional Medicare, no prior authorizations, no restricted networks. You go to Cigna, you go to Anthem, you go to United Health Cartel, you go to Humana, any of them. Now you've got these narrow networks, and they're just trying to get these doctors. If they don't own the physicians, then they just make these rules that, well, if you're a Medicare Disadvantage member, you have to try 16 drugs before you can be on what the doctor wants you to, which actually is the lowest cost one the doctor wants you to be on. But they mandate the more expensive ones. It's craziness. It's crazy making.
And then they've implemented these medication benefit managers that charge you a monthly payment to have the doctors fill out a patient assistance program, and they completely drain the funds on there, so you'll have maybe 3 months of medication, and then you'll owe for the entire medication. And they use this scare tactic of, well, if it's not covered, you're going to be responsible.
So you better sign up for this accumulator program. Anything that only benefits an insurance company or a pharmacy benefit manager is not good for healthcare.
Can I just go into hospice instead of having to choose a plan?
Right?
I think you have to have insurance
You
for
might
that.
you might have to I'm waiting for United Health Cartel to start making coffins, reusable coffins for their members. Here, along with this plastic shoehorn with our logo, you also get the use of this coffin for 24 hours.
If it wasn't for the Affordable Care Act, I could never afford health care.
Listen, the Affordable Care Act had some good pieces of it. It really does. But I don't know. I can't afford health care, and I'm a working person, and there's Nick.
Hello.
All right.
Crying
I
out
need to
that
go
you're gonna need
get
help.
my day going.
Yep.
So I'm going to go do that. We will be back. Fiddlesticks.
We have lots of information to share, lots of it. It killed it for us middle class. Where do you live? Because where I live, the clouds move if I look out the window.
The clouds move for you. Okay. We're in
Nick?
Bridgeton.
Nick, are we in a simulation?
No, we're not.
I'm probably AI.
We're not. I'm going to have some M&Ms. That's what needs to happen.
You had a bad sense of humor.
M&M time.
Oh yeah.
Hi, SoCal. That's where Dr. Back was from. Hey, we will, and insurance companies will keep freaking reporting my lives.
still get that chicken salad?
Medical bills are discharged. People are so obnoxious. Yeah, they are.
I don't know, maybe.
Hi, Maine. Did you call your representative? Is there such a thing as pre-existing conditions? Yeah. You are a very gorgeous robot. Thank you.
Me?
I'm kidding.
What?
I'm one of Elon's
You don't like
newest.
sweets. I don't like you.
Oh, you took my coffee.
Ha 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 ha.
You know?
Yeah.
Well, it's so funny.
Ha 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 ha.